corrected itself. Sorry about that.
Oh, I think we're live now.
It'll be fixed, because I had a couple of things I gotta fix.
Lori, can you hear us?
Technical difficulties right now. Check.
Can you hear me now?
Sing a song.
My baby takes a morning train. She works from 9 to 5.
Oh, good. Corey's singing for us.
I heard that. Okay. Lori, can you hear us?
There it is.
Let him know that we're.
Can you hear me now?
Sing a song. We gotta hear the song.
No, we can stop.
Yeah, we can have Corey sing us a song again. Okay, our first item agenda was the liquor license for. Can you turn that down just a hair, please? For the Lienzo Charo Rodriguez. After discussion, there was a motion by Crouch and a second by Vinton to deny the liquor license. There has been well over 100 complaints regarding this location for theft, alcohol, livestock, just several things. So the motion was liquor license was denied 3-0. At this time, we're at visitor recognition. Is there any comments from the public or written or anybody call in, guys? Anybody say anything? No one's reached me. Okay, moving on to supervisor updates. The only one I have is we're continuing to, every meeting that I have is continuing to be via phone, Zoom meetings, emails. We've actually canceled quite a few. And juvenile detention has hired a cleaning company to come in and clean the detention center on a weekly basis. And they're going to continue to do that for at least a month. Anything you have, Mr. Crouch or Ms. Vinton?
Yes, this basically doesn't pertain to a lot of supervisor work here, but I feel the Resource Center is a very vital place of employment here in Mills County or in the city of Glenwood, and we had a phone conference with Department of Justice, GRC, Department of Human Services, and a parent family group for about 2.5 hours on Saturday morning. One of the biggest things that was brought to light was that they're going to have what they call community integration. They have some clients that want to move to the community. Plus, if there's some guardians or people that want them to move, why, if we don't do it as the parent family group or the state, DOJ is going to step in and set up the guidelines, and we'd prefer to have our own, so, but we really had some great questions asked by parents on, especially the coronavirus. What's been going on, or there's no positive tests at the resource center at all, but between workers or clients. There's 119 clients at the resource center right now, and there's I think 197, excuse me, and 19 patients in waiver houses, and right now they only have room for 2 clients to go to waiver houses, so that is our big dilemma. Yeah, we got people that want to get out, but we have no place to put them, and to have a waiver house converted over is very expensive for the owner because you have to have at least 4 to 6 bedrooms in the house and might have to put in an extra bathroom or things like that. Yeah, there's aid and stuff to help do it, but right now the price of rent, I don't know of anybody that wants to demolish a house, but things. But anyway, we're going to have another conference call in a month, see how things are going. but right now everything is pretty stable. They have people hired from University of Iowa coming in. They've hired 2 doctors out of Nebraska, psychiatrists, and anybody they've got bonuses for people that want to go up there and start working. So if you know of anybody that wants a job, and it's not just RTWs, it's anywhere from not management, but from office personnel on down. So
Good.
But that's the only one I have. I have a couple this week that's, on the telephone, and I think they're all right, but it's awful nice to look at people in the face and talk to them. But
Yeah, it works, but
Absolutely.
it's not an answer.
Absolutely. And I just got a email from CEO Wendy Mueller, which is of West Central. I go to Harlan for those meetings, but as you know, we all do our phone meetings. And she just applied through Delta Dental and awarded $5 million to split between 6 food pantries. And every dollar will help seeing demand for the food. It isn't anything like or just toothbrushes and toothpaste. It is truly food that everybody is in great need right now. So that was a big hurrah for West Central. And if you would like further information, she would love for you to call her, and I will put the number up on my supervisor website. So the doors are open, and she can help you with any assistance you may have. So that was it for this week.
Okay. Now it's time for our 8:30. We have Corey Gaston, the Mills County engineer here.
All right. We have no utility permits. We had one turned in, but it was all within private roads, so shoot that back to the utility company. Tell them to contact the landowners.
Wanted disadvantage to the private.
you should have collected first.
Yeah.
Then said, sorry.
Sorry.
I wouldn't be surprised if the check is in the mail. We'll send it back, I guess. First formal action, open and award office mowing proposals. We received 2 bids. I probably should check with the auditors just to make sure we didn't receive any here at the courthouse.
I'll check.
Could you do that? One from Stallert and one from Kemp's Lawn Care. Doesn't sound like any came to the auditor's office, so I'll go ahead and start with Stallert's. Okay, quote for 2020 mowing season. Mowing and trimming weekly are specified by customer. We usually go bi-weekly. Amount $30 weekly.
$30 weekly?
Weekly, $30. And who's that with?
R&A Lawn Care. Dave Stollert.
Oh, sorry.
Start.
Sorry. Yeah. Whatever there.
Second proposal came from Kemp's Lawn Care.
Kemp's?
KEMP. And this is for a rate of $35 weekly or per quantity. Very similar. I suggest you guys award the mowing to the lower total to R&A Lawn Care at $30 per quantity.
$30 weekly, right?
Each time they mow it.
And we'll probably have them go bi-weekly. That's what we've done in the past. So.
Okay. Would you said or per what? Per what?
Per mowing.
Per mowing. Okay. Okay.
I make a motion to approve the R&A Lawn Care Mr. Dave Stiert for $30
For mowing.
per mowing.
Second.
We have a motion and a second to approve R&A lawn service for the fee of $30 per mowing. Is there any other discussion? Hearing none, all those in favor?
Aye.
Aye, approved, same sign. Opposed, same sign, sorry. Motion carried, 3-0. Voucher number 24 to United Contractors.
Yes, this is for the 190th Street project, the railroad overpass. It's majority of the work that has been completed the last month has been bridge work.
Good.
They were setting beams, the northern span beams, last week, and yesterday they set the middle span beams over the railroad, and so they just have the southern span, which was either going to be today or tomorrow. So, seen a lot of progress.
They're moving.
Yeah.
Good.
So
Taking advantage of
they're
this great
looking-
weather.
Yep, they've been able to do a lot of work over the winter. That they got all the substructure down, the piers, the abutments.
That's good.
Really, now it's just decking and pouring the slab, and hopefully we get them out of the railroad right away so we can stop paying the flagger at the railroad their exorbitant amount hourly cost. Looking, they gave me an updated schedule about a month or two ago, and they're looking at end of July, August being open to the public. And so
Nice.
I think we're still on pace for that. Minimal earthwork left to do on the project, so hopefully we can get some seeding done and paving come following along here late spring, summer.
Is the box done on the south end over that ditch?
All the structure's done. They have some riprap to place,
Sure.
and that's going to be a challenge because of that drainage ditch is still full of water, which pushes back into the ditches, and so finish work we're kind of at the mercy of the drainage ditches getting completed to the south, which
Right.
they've been working on.
Right.
Contractors been working on, and if the Missouri River goes up, that anytime the Missouri River goes up, we see groundwater rise with it and fill up our ditches, and it prevents us from finishing that. But
Okay.
this, oh my goodness, I forgot to print out the total again.
Estimate.
It is right around $240,000. I can give you guys the exact amount when I get back to my office. But this does come out of the farm to market account, so this is not coming out of our local budget.
It's just a contract progress payment.
Correct.
And you said it's around 240?
Yep.
240,000, not 240.
It's $240, Carol.
Yeah, we'll send them 240 and see if
It
that
sounded
works.
like a straight instead of a dollar.
Well, I make a motion to pay the voucher 24 to United Contractors for the project RFM for the 190th Street New Bridge for $240,000.
You can call back up so we can put the right amount in.
I will.
Okay.
Yep.
All right. Second.
Okay, we have a motion by Vinton, a second by Crouch to approve the progress payment for the 190th Street project to United Contractors for approximately $240,000. The county engineer will call us and get us that exact amount. Is there any other discussion? Hearing none, all those in favor?
Aye.
Aye.
All right. Motion carried 3-0.
Underneath my signature.
sir.
If you'd like, we could kind of go over my general discussion items.
That would be fine.
Alright.
Splendid.
I guess talking a little bit more about 190th Street, the project. I have received word from FEMA that they are not going to issue a memo of determination, basically denying our request for reimbursement for increased construction costs on the project. So that is good news. So they're not going to issue that determination. I've been working with Iowa Homeland Security, reached out to Dave Zeke and the other representatives, and it sounds like it's going to get moved forward. They sent me an email Friday asking me to once again summarize what exactly we're asking for.
Wow.
So I'm going to just resend the letter that I had to type up for them previously, or send the email I already sent them previously. But what it is to remind you guys, it's we lost. It was a presidential declared disaster, which through contract language there is a clause in the contract that it acts of God. Usually a contractor is responsible for any damages on the site, but if there's an act of God and a declared disaster, the owner is responsible. So we approved a change order. State DOT also approved it. That increased the cost of the construction, mainly a new borrow site, because the original one got flooded out. That was the majority of the increase in costs. Also, other construction material costs increased because of delays because of this declared disaster. That's going to be pushed forward, so hopefully we can recoup some of that additional or increased construction cost, and hopefully we'll get that rolling now again. So that was good news. Also, we have Denko construction coming in this week to do some crack sealing on 3 different roadways in the county. They're going to start on H34 just outside of Emerson and go west 3 miles to Highway 34. And I think they're planning to start tomorrow. And then they'll move to Hillman Road just west of Glenwood and complete crack sealing from Highway 34 to city limits. And after that, they'll move to H12 between 221st Street and L55. Just kind of typical maintenance crack sealing on our asphalt roads.
Oh, it's all asphalt. Any seal coat or both?
All asphalt.
Just all asphalt. Okay.
Excuse me. Between 221st to
L55.
L55.
Silver City Highway.
Okay.
I will be attending Emerson City Council's meeting tomorrow evening virtually. They've had ongoing discussions about trying to slow down traffic coming in from the east on H34. Since it is a FM extension, the jurisdiction actually lies within the county. So any new signage, traffic control devices need to be approved by this board. I've been encouraging them to look at sign enhancements before putting in a stop sign. FM extensions are meant to be a thoroughfare for farmers to get their crop to market. And that street already has 2 stops on it going through town. So we're kind of defeating the purpose if we put another stop sign on that route. But we are looking at, when I say sign enhancements, that would be red flags on it, trying to gain people's attention, a flashing beacon. They brought up a flashing beacon, which would be a step above that. And we could also do some other warning signs, advanced warning for intersections and stuff like that. So.
I guarantee farmers are bringing in their big tractors and diss and stop 3 times. I got a feeling.
their latest stop sign was on a park intersection, so I definitely understand the safety there,
Right.
high pedestrian crossing, which they put in about a year ago, so you guys will be seeing a resolution to approve that stop sign post hand, but yeah, I anytime there's new traffic control devices put up, I also coordinate with the sheriff's department since they're the ones that have to enforce it.
Sure.
And I think they'll usually tell you the same thing I'm telling you, that stopping traffic on these through streets get a lot of grumbling from the public.
Right, right.
The only other item I had for general discussion was update on the conveyor belt project. Mid-America's filling their fly ash pits, and contractor was awarded their contract. Ames Construction was contractor who won that award, and we've been working trying to come up with a appropriate alignment or route for their conveyor belt. It just so happens they want to go exactly where we plan to put in a new roadway connecting Bungay Avenue and Applewood, just to the west of I-29. So we were not in the design stages where we had a lockdown location, within the foot of where we wanted this roadway to be. We had a general idea. Doing a little more research, because Ames needs a lockdown route. There is a gas line that is also parallel to that route, which may force us to move our roadway anywhere from 5 to 20 feet or so to the west of where we originally thought, which would then push this conveyor belt the same distance. And they're trying to lock in their route as soon as possible so they can start building, or at least turn in permits and order their equipment necessary and complete their final design. They've been good to work with. I'm just right now waiting to hear back from the gas line company about if there is the ability for us on our right of way to overlap their easement. The gas line has a 25-foot easement in either direction from where their line actually is.
Okay.
And our road alignment the actual paved road wasn't gonna cross over the gas line, and we knew that wouldn't be something we could even get away with without having to either pay for a relocation of the gas line or something.
Right.
Exactly. But my question to the gas line was, can we overlap our right of way, our back slope of the ditch? Can that overlap your easement? So not even going over your gas line, just going over their part of their 25-foot easement. And so that's where I'm at right now.
That way they'd be in the right of way like they are now,
And so I think that's
in most cases.
going to be okay. But before I approve or tell Ames that their route's fine, I just want to make sure. And they've been easy to work with, and they said, well,
Good.
we really want our route down, but we know this one section and then also right near Applewood, if we needed to move it, 20 feet, we can make that happen, and we can still continue with the design. So we're not holding them up.
Good. Maybe while they're dismantling it, they could throw some dirt in for our fill on our road while they're bringing it back.
They made the comment, you guys just want to hold off on building your road for 3 years? If they were to just, been hauling for 2 years, we could have made it work, but I think we want to try and get this project going when we
nice.
get funds obligated, so that's kind of an update on what we're dealing with.
That is truly going to be amazing to watch that.
Yeah,
That is.
It's a
It's
positive for us, since I
mind-boggling.
think having decreasing the amount of truck traffic on those routes, I
Absolutely.
think will really be a positive for the county, especially our roads.
Yeah. Great to watch. Good.
Couldn't quite make it to 9 o'clock.
We got a road sign at the school bus stop sign out by Art Renzi on Gaston. Evidently the winds broke it off. It's laying over in a ditch. You can't see it from pickup, but you can from tractor cab. So
How do you
One
know?
good of that.
I went by it twice.
And where does Art live exactly?
Yes, and past the subdivision.
You might have to refresh that, Corey.
Maybe I should just do a search on it. There's Gaston, brushes. Oh, you found it? Nice.
You just typed in Ramsey.
Ah, and then goes back.
Right there, right where Gaston Avenue is. I think that's Art. Nope.
So it'll be just
Mm-hmm.
east of
Go to search for name. There you go. You were close.
just east of 262nd. Okay.
That's just east of his driveway a little bit. There's the school bus stops just over that hill there and picks up 3 different kids. Yeah.
So you have some time
Yeah,
to
we
fix
can
it.
just leave this
Yeah,
down for you.
just till the
They
30th.
used to when they were in school.
Yeah.
And I don't know who the blade operator is on 250th Street, but just to complain, it's not from vehicles taking off and making the rumble strips. You can actually see the angle of the blade as he hopped down the road.
We're talking south.
Right there at Hershey Avenue out here at the booster station. And if you get clear over on the east side where there's very little rock, it's not bad.
Yeah, that's where they need those.
Our rock stockpile is starting to really get low. Really hoping that,
When are they moving back in, do you know?
to my knowledge, they're stripping.
Yeah, I mean, because they've been blasting, well, I wasn't home this morning, but yesterday morning, early, they set off a charge. And
I haven't talked to them lately, but last I heard that they thought they'd be producing at the end of this month.
So, did you hear it blasting?
Oh, yeah.
You do?
Oh, yeah. Well, that Janelle Goy that lives there right at the golf course corner, she has a seismograph deal in her basement. Because years ago, they cracked her basement walls.
It can go that far.
Well, it depends on the cavity that it gets,
Sure.
that they put the charge in. But,
Wow.
yeah.
That's
No, she's,
interesting, Richard.
so I mean, she knows, I mean, she can probably feel it. But,
Oh, I do have one other thing for general discussion.
Okay.
Sorry, sit back down. A couple weeks ago, I brought in this ad for Culvert Cleaner. It's an attachment that goes on excavator, or a mini excavator, grade all, and so we had our shop foreman look into getting a quote for it, and we're looking at a cost of about $3,500 plus $175 for shipping. And the company is out of Arkansas. So still think this would be a great tool for us. If we can avoid replacing 2 or 3 culverts, it pretty well pay for itself. Right now, it's tough for us to clean out pipe culverts that are, smaller than 6 foot wide. We just don't have a tool to kind of do it other than manual
Lay it down,
labor.
get a
or-
shovel
Crawl
out.
in there and
Mhm.
start cleaning. Yeah.
So anytime we have a 24, 36-inch pipe that's completely silted and full, we pretty much have to replace it.
Mhm.
And that takes some time.
Digging the driveways
and
out.
New culvert.
Mhm.
And so if this can save us from replacing a couple culverts a year, it'd be well worth it. And it would also help in cleaning out the larger culverts, box culverts or those big. We've had issues with beaver dams, and on M16, especially on M16, they come back right after we clean them. But this would make it a lot easier to clean out those as well.
Sure.
So I'm not asking for approval right now, but kind of giving you a heads up. Probably come to you in the future.
Good.
We got a couple more minutes here before our 9 o'clock item. We will go on, we'll pause this here for a second, and we'll see you back at 9. Okay, everybody, it's 9 o'clock. Our next agenda item is the second reading of Ordinance 2002, amendment to add Chapter 26 Floodplain Regulations. Do we have a motion to approve the second reading?
I make a motion to approve the second reading of the ordinance 20-02.
Second.
Okay. We have a motion and a second to approve the second reading of Ordinance 2002. Is there any other discussion? How about the third reading, guys? Are we gonna do that next week, or would you like to?
Make a motion to waive it.
Can we make, you wanna vote on this one, or you wanna make them all in one?
Well, you can do this as the second, and then since you've already made the motion and seconded it, and then you could request that
Move on to
I
the
make a
next one,
motion
then.
and a second to
Okay.
waive the third reading.
So we have a motion and a second to approve the second reading of Ordinance 2002. Is there any other discussion? Hearing none, we'll do a roll call vote.
Okay, wait a minute. All right, so we have a motion to approve the second. We need a motion to waive the third. Then we need a motion to approve the entire ordinance. So I
Yeah,
just-
but right now we're on the second reading.
Oh, we're still seconding?
Yeah, we're still on the
Sorry,
second reading.
I was ahead of you. I
No, that's
apologize.
okay.
Sorry.
You want to do a roll call on that since it's for an
You don't
ordinance,
have
or?
to. No,
Okay.
not till the
Hearing
end.
none, all those in favor?
Aye.
Aye. Now we have the third reading.
I'll make a motion that we approve the third reading of ordinance 20-02 for the floodplain regulations. And approve the ordinance, right?
We're
No.
gonna waive,
You're gonna make this
Waive
motion
the
to waive the,
motion.
Okay.
to
Yeah, so
approve
on
the
the first
third or
one.
waive it, yeah, waive it, yeah.
we'll get it.
Hopefully.
And then make a motion, Richard, to approve the ordinance?
Yep.
Okay, I second it.
We have a motion and a second to waive the third.
Waive the third. And then,
Yeah, all in favor?
Aye.
Aye.
And now we have the approval of the third reading.
no, you're gonna approve,
Approve the
you're gonna
ordinance.
approve the entire ordinance now. Because we did the first, we did the second, and we waived the third, now we're gonna approve the, it's a little confusing.
I make a motion to approve the whole ordinance of 20-02.
Second.
We've got a motion and a second to approve Ordinance 2002, amendment to Chapter 26 floodplain regulations. Is there any other discussion? Sure we did that right, guys?
Yeah.
Just want to make sure.
We've done the
Yeah, I
ordinance
think
for a
so.
while.
Right. Okay. Like the monkey and the football. Any other discussion? Hearing none, all those in favor?
Aye.
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 Should I do roll call?
No, we don't.
Roll call on the
Roll call.
entire ordinance. Mayberry,
Yes. No, we don't.
Crouch,
Yes.
Benton.
Yes.
No, we don't.
No roll call.
Good to hear. I can send this copy of the ordinance up to Iowa DNR, and then also and our proof of publication, and they'll kind of put their little rubber stamp on it before I send it off to FEMA, and then we'll stay eligible for flood insurance within the county and stay all federally under compliance.
Till the next change, the baseline established and started.
And it'll be coming.
Good.
Thank you.
Because you've got the whole entire ordinance, you just need the back page.
All right. Well, I think that's all for me.
I think that's all you've got.
Repeat, right? Do, redo.
Yeah, we'll make sure we got everything done. Yeah, things still busy in the office. I mean, kind of thought with the coronavirus things would slow down a little more, and obviously our interaction with the public has a little bit, but with,
Not projects.
Still
Still-
keep the roads up.
yeah, we.
It just takes it 3 times longer, doesn't it?
There has been some warnings that we probably will be expecting less money in our road use tax fund through the state, because most of that's collected off of gas tax and car registration. And yeah, I think there's like a 30% decrease in traffic throughout the state, so they are warning us to be expecting a little bit of a hit.
Sure.
You know, even in our lost count, you know, it's not gonna stay.
Local
with
option will definitely be affected.
It's not gonna stay at 50,000. So,
But there is some optimism about receiving some of the, if there was a little bit in the first CARES Act for transportation, majority of it though going to aviation, and I can't remember what the other branch was, but
For county assistance.
but I think reading from the ISAC update, they were pushing to have some more assistance goes to transportation departments in counties. So we'll see.
Cross our fingers.
All right, you guys have a good rest of your day.
Thanks, kiddo.
Thank you. Our next agenda item is at 9:30. We will go on break until then. See everybody that's listening at 9:30. Thank you. Okay, it is now time for our 9:30. I did. It is for a 9:30 agenda item. Jill for the treasurer for discussion of resolution 2015. What's going on, Jill?
Okay, I'm here this morning regarding Resolution 2015. I'd like to make an uninterrupted statement at this time. I want to know how you arrived at giving a stipend to one elected official versus all elected officials. Every office in this courthouse was affected by the flood. I had to tell countless upset customers they had to pay taxes at a home that was no longer livable because our taxes are a year in arrears. The treasurer's office traffic increased significantly with duplicate driver's license and titles being issued at no charge. Under the governor's proclamation, we helped with the disbursement of the flood money towards customers' taxes. I am confident other offices realized the increase as well. Please know, not only with the flood, at one time or another, all departments have gone above and beyond without additional compensation until now. I also know Resolution 2015 can be amended to include additional elected officials or rescinded. So now I'd like to open it up for discussion on how we arrived at this.
I would just like to briefly say something, just to talk about my vote. When it was brought to my attention on the resolution, I am 100% in favor of what the auditor has done. She has gone above and beyond her call of duty. There's not a doubt there.
Nor in my mind either.
You're right. She did. She has, and she still is. But my issue with it was there's several others that stepped up, including not only elected officials but volunteers. Alan Hughes gave us his building for 3 to 5 months, and he got a free load of rock out of it. I mean, he would like $5,000, I'm sure. Larry Hurst's office went above and beyond their call of duty, even though it was his job. Secondary Roads, Corey Gaston and the entire Secondary Roads crew.
Agreed.
They were out in the wee hours, so that is why I voted no.
Agreed.
Did she go above and beyond? Undoubtedly,
Oh,
yes.
yes, I agree
But several
100%.
others did, and I just didn't want it to look like she was being isolated, but
I agree 100% with you.
right.
May I speak upon that as well?
Please
Sure.
do.
Okay. The vast majority of that ordinance has to do with preparing the budget for the Board of
Exactly.
Supervisors. There are several counties around us, Harrison, Page, for 2, that receive a stipend for assisting with the budget. And since we've had an extensive amount of things to do on the budget, they have been getting this for years.
Exactly.
And
And all of Harrison County's elected officials get a stipend, or as they call it, a performance pay, in addition to their salaries.
okay. And I just want to say that the account board made that recommendation as well, that I should receive that. I have some response from Jim Tucker as to what their reasoning was when he sat in here and explained on the stipend portion. I'm not disagreeing that the rest of the departments haven't and been a part of it, but I spent many weekends, nights, continue to doing things. I'm in constant contact with these people all the time. I am required to be the person on the FEMA line. I'm the chief financial officer for that, and I have to continue on with this buyouts and all the other added duties. I took on the recorders, and for a time period, which a lot of counties, when they have done that, they receive a stipend for that. I didn't ask. I've had to take on extra duties in my office due to, people being gone and leaving. So
We have all done that too.
right.
We have all done that.
But I spend many nights, many weekends still working on all this at no extra. And I don't know, I take all the complaints for the county.
Not all of them.
Well, usually
Not
someone
all of
comes
them.
down and gives them.
Not all of them.
Well, I mean, with the employees come and usually complain, and you come to the board as well. I'm sorry that you feel this. This is just a one-time thing, not.
According to the what I heard the last time, it could be an annual thing.
It-
That was what was in the minutes at the last time.
It could be. It could be, but that doesn't necessarily mean it is. It'll be, I would assume, re-looked at each year.
Okay, so you have gone above and beyond with the flood and all of these things. So what I want to know is how another office gets compensated when they go well above and beyond. I'd like to make a closing statement. I know it's my job to do the best I can for the taxpayer of Mills County. I have worked very hard to be money conscious with my office budget and not spend unnecessarily. You all know that. You could call it tight, frugal, whatever you want to call it.
We call you tight.
Thank you. I have gone through our bank accounts, and the previous treasurer in 2017 made $7,340.99 in interest on 5 accounts. I called the bank and negotiated a higher interest rate in 2019 and made $94,255.53 on those same accounts. In just the month of March of 2020, I made $68,3904 in interest, almost what the other treasurer made in 1 year. I took a money market that was making 0.3% interest, converted it to a 1-year CD at 2.25%. So the $2,789 went to $21,142.15 in 1 year. This is just the counts that I've been working on. I have multiple CDs. I have done the same way. I have cleaned up multiple jobs that the other treasurer left, and you guys know that as well. I put in numerous hours to make this office and this place a better place, and several of those hours have been uncompensated. If you took how many hours I put in here every week, I probably make about what my deputy makes.
But isn't that why we hired you more help? I mean, we were giving you everything you always ask for, Jill, and we commend you of your wonderful job and your duties, and that's your job. But we understand when you were overworked and overcome, we gave you some help. So we hired you some help.
But what I'm
So
saying is,
you want more.
no, what I'm saying is I don't know how you single out one person to compensate.
Because this gal helped with all the maps, the flood maps, the reports. With those reports, I want you to realize we were far ahead than the other counties. And with us being far ahead, we had got $12.5 million.
And did you
We
get
were
compensated
there.
for all the time that you put in, the extra time you put in?
Look, us supervisors are compensated. It's our job.
Exactly,
It's our job.
exactly.
So
And that's
with
what I'm saying.
that auditor does not have to write out all those reports as the other counties. That's why they're so far behind. We have an auditor that not only came from PJ and understood those families, she took the abuse, she took the comforter, she tried to get things moving. And without her help, I think we would still be trying to decide what the hell are we gonna do. That is why I commend Carol for what she has
I
done
do too. And I'm
for
not
the
saying
county,
she didn't do
for
anything.
the flood families. And hopefully, now that we've been granted this money, it's gonna come down the pipe. But there would have been no way us three would have ever understood. The phone calls was right to Carol. It
And that's
wasn't trying to connect all three of us, so we were so busy of our other meetings. We would come to Carol, she was our go-between. What's going on? What's happening?
Exactly.
So she had all the addresses. She spent numerous hours contacting these people.
And I
Where
don't
are
doubt
you at?
that.
Where are your addresses?
I don't doubt
I'm
that for a
sorry.
minute.
She has just gone far and beyond. That's my feeling.
And the revenues will come back from us through the FEMA to pay towards that stipend and many more for the county.
Okay, and so is that stipend coming out of the flood relief? Is it, you're talking FEMA money? Is it something
It
that?
will be reimbursed through those funds.
Okay, so if I lost my home in PJ and I listened to that and I heard you were getting $5,000 from FEMA, would I be a little bit upset?
It is part of the administrative portion
Okay.
that we're already receiving
Okay.
as a part of that in agreement with SWIPCO.
Okay,
It's not above and beyond, it's in part of the
that's
administrative.
the way it sounded like on the recording, is that it was FEMA money that was flood money.
It's part of the administrative portion that SWIPCO is receiving for doing all of what they do.
Okay. Well, in closing, I just want to say there is no right way to do the wrong thing. So that's my piece, and I would like to come back when public health is here I have a gal in my office who is out ill. All of her symptoms sound like COVID-19, but they do not test anyone other than healthcare workers and if you're being hospitalized. So that's why it sounds like Mills County has no COVID-19 cases other than the one positive. So we need to decide what my office should do.
Good.
Okay.
And Richard, everybody spoke but you. I just would like your feelings on this, if you could enlighten me. Just one simple question or one simple answer
No,
is just fine.
I felt that Carol deserved what the compensation board had asked for. As far as other county officials, head officials, or however you want to categorize them, I would say that if it was brought to us from someone in the office, some other employee would set in or something like that would come and say, well, I think Jill has went above and beyond. She needs compensated for this, but in my return is kind of like Carol says, you came and asked for help. We let you hire more help. So I feel it's kind of an equal deal. The hours that you put in extra as an elected official, whether you're in the courthouse here or as a supervisor, if we're asked to do something as supervisors above and beyond what has been put forth in years past, compensation wise, no. I ran to take care of the people, and that's my theory all along. I'm not going to back off of it. If I have to sit in here 40 hours a week to get something done, that's what we did.
Exactly.
Do we ask for any more? No. That's part of our duty. I feel as an elected official in this capacity we have in the county. If you're going to make your county healthy, a good place to live, take care of your people, the hours you put in is what needs to be done.
Exactly.
Compensation wise, I've never looked at it. Yes, the money is fine. We're about in a lower third of what counties our officials are paid down here. So I don't know, Jill. I'm kind of shocked in a way, but yet I'm not. It's good to be brought to our attention, you know. Uh, so that would be my answer.
Thank you. Thanks.
Oh, we're right on schedule.
We are.
Our next item on the agenda is the formal action to authorize the chair to sign site-specific environmental review for the CDBG NDR project. This is just a formality for.
Right, I received these from MAPPA, and as changes happen and things go down, they request us to sign certain elements that they have to have for their reporting.
I think it's almost a yearly thing. I think
Yeah.
You would think.
she was in charge last year. Carol was in charge last year. She had to sign some stuff just like it. So I'll make a motion to authorize chair to sign.
And I seconded.
Got a motion and a second to authorize the chair to sign site-specific environmental reviews for the CDBG NDR project. Is there any other discussion? Hearing none, all those in favor?
Aye.
Aye.
Aye. Motion carries 3-0. Next item is the authorization for alternate signatories for section 106 compliance.
What's that about,
That
Carol?
is-
That's also the
It's
CDBG.
also
Oh, it
for the
is.
MAP
Oh,
and
yeah.
CBG project. This is for the East and West Initiative projects, for those of you listening.
Yes.
Okay.
Do we have a motion to approve or disapprove?
I make a motion to approve the authorization of section 106 compliance.
Second.
We've got a motion and a second. Is there any discussion? Hearing none, all those in favor?
Aye.
Alright, motion carries 3-0. Our next item is at 10 a.m., so we will do a short break here and we'll see y'all back here in a few minutes. For those of you online, thank you.
Okay, we're doing the bid first.
Okay, our next item on the agenda is for 10 o'clock is for the Cummins, bids from Cummins Sales and Service on the courthouse generator repair. What do you have, Miss Auditor?
Okay, we received an estimate for 3 technicians to return and replace the radiator. The estimate includes parts needed as well as 10 hours on site to complete the repair. If you approve it, then we need to sign and return the estimate. The total of the estimate is $14,693.88.
No,
It's your generator, Larry.
Is that now that I'm reading that, is that a new generator or I
No,
mean
no,
a
no.
new radiator, or is that just repairing the old
That's
one?
No, new
It
radiator.
is new, okay, because it said
$14,000, it better be a new one.
It's a new one.
generator?
The
Yeah, radiator.
radiator,
Yeah, it
not
better be.
generator.
Radiator, correct.
Well,
So
they got-
7,000 for the radiator and 7,000 for the labor.
For
Roughly.
labor.
Parts and people,
Roughly.
Right.
the 3 technicians that they're figuring at 10 hours to do it.
Yeah, the generator itself is
I
300,000.
can't generate enough on the farm for this.
I know.
So, this is I don't know what other options we have at this point.
Yeah, right now, like Patrick, we discussed last week,
Yeah.
we only have about 7, 8 hours that I could operate without.
The comm center needs to run 24/7.
So, and I think we need to be, the generator was, I was involved in that selection.
Sure.
And so, but, our old one was a natural gas operation. This was, of course, diesel. Diesel's good, reliable, everything else. I mean, the type generator this has a good track record, so I have no idea why we just seem to be having bad luck every once in a while. Some of the stuff is identified during maintenance, but we had one other major event here several years ago that happened to this thing. I think it had to do with the engine, I'm pretty sure. And so this is the second major I can remember since it's been installed. It's just unfortunate, but every time you work on that type of equipment, it's gonna be expensive.
It is.
Yeah, but $7,000 just really,
I
think that can be
it's high
negotiated
praise
out,
in
but
American labor, I guess.
when do we have to let them know? How soon?
Well, how soon do you want it fixed? Because we're running without right now, right?
They ordered the radiator, I'm pretty sure, because they gave us 7 to 10 days to get it here, and we are on approaching that 7 to 10 days, so this
Yeah,
is
but is it here?
they haven't told me.
The only thing that scares me is if we're entering storm season, and if we
Yeah,
have
I
if we have an outage,
Right.
the comm center's got to live.
Right.
So
You need
what's
to be
our
able to call, you
option?
need to
Can we
answer.
look, since it's a Cummins generator, does that mean we're entailed to a Cummins?
Well, if we decide to switch out eventually, but you invest a ton of money for this.
You're going to lose warranty and everything
You're
if
gonna
you
lose
start
everything.
putting aftermarket different parts on it.
I'm just trying to think what it would cost to hook the electrical part up to it. Because it's just like changing vehicles with the dog. Costs us $10,000.
It isn't just the
It isn't
last,
just
you've
a-
got more.
It's just not just a new generator we would be getting. You're not gonna take it and plug it into
Hooking it
it.
up to our grid, per se.
You know.
So easily 20,000,
What?
20,000?
No more than that.
I was gonna say, probably your best bet
Additional.
on this is to pay this and then
Well, we
look
do research.
for
I think we need
research
to
for
move forward,
something that's gonna be a lot
maybe
more.
Or
feasibility.
lease. Can we lease one until we have time to look for something different?
You'll have that much in unhooking this one, hooking the other one up.
Seriously.
Yeah, because we can't
If
plug
I-
it
if
into
I-
the,
If I hook it into the Sally port, I think it's only gonna help me and not help the rest of the courthouse.
Yeah.
And that's the contingency I would have. That's why I talked to him initially about coming up, and then I was ready to pull the trigger to rent one to get it down here just to have. I wanted to make sure it was gonna be
You need
available to me.
something.
So,
We have a $500,000 machine out there, roughly, and they're expensive to run, they're expensive to
It's
maintain,
an
and
investment.
if the board doesn't mind, I'll take this across and have Lori call this number and stuff and see if they have anything, see if they have it, how soon it's gonna be here. We've already waited over a week, almost 10 days. So I wanna know if it's here to put in. I don't wanna wait another week. So, I don't know,
Good
you guys,
Good point.
They should get back and tell us.
I was saying, you could come back to your response.
But I'll see it, I will track, Ben was, he was over your side of square yesterday.
In my office.
Was he your place? Yeah, that's the reason why I got previous. So I saw him with his lift truck this morning, so I will call him and get him stopped by and we're gonna check this switch we have in the Sally Port. Where the switch is makes it kind of awkward, you know, if I brought a mobile generator in, if I can use that 80 kW down there and hook it in, it just depends on where the cable I have will interface with the switch we have.
But wouldn't it be good to pull it out and run it and?
I
kinda-
have to run it periodically anyway, the state
Oh, you do?
requires me. And they know when I run it, cause they have a GPS, some hardware in it, so when I turn that thing on or I move it, they know where it's moving to and when I run it. And once a year, I'm supposed to put it on a load. So a lot of times what I do is I have, Cummins, I got them to do the maintenance contract. We did an oil change on it here recently. And, I've asked them to bring they have a little thing, looks like an oversized computer PC and it puts a load on a generator and come down and test it. Otherwise, I gotta bring, the group out of Altoona, the state contracts with, and that's more cost. So these guys are taking care of it now. And they only come down when I call them, come down for the one I have down here from the state.
So how about other courthouses? Do they have a,
It depends on
Cummins
size. No, it
generator?
depends. Some of them probably have
Depends.
cats, probably some have Cummins, some probably have, it just varies. There's different brands out there.
Cummins is a damn good brand.
It is.
It's a good
Caterpillar,
diesel, it's
Cummins
just- they're
are
good.
very good brands. They're probably the two leaders out there.
Well, you compare them to a John Deere, right?
Yeah, well, believe it or
You
not,
guys-
I
To
think
keep 'em-
Cummins is
keep
even
'em
in,
working.
I think in John Deere now.
Yeah.
He's-
Yeah.
Yeah.
you know, all your tractors, all your farm equipment use Cummins engines.
That's why it's expensive, see? Just like green.
Well,
Well,
they're
if you,
pretty
if you could take
durable.
the radiator out and take it up there, you could probably save a couple $1,000s.
Probably.
Yeah, but you gotta get a crane.
Oh,
You're not gonna-
yeah.
you're not
Oh,
gonna do-
yeah.
You're just not gonna
Oh,
lift
that's
it in the
why it
back of the
takes-
van?
Yeah, it's not something you pull out and throw in the back of your
About half the size of this table,
Explorer.
Carol.
Mhm. Probably, if not
Yeah.
closer to this whole size, yeah. Probably about that wide.
But we have had some problems, but, so,
Well, it seems like our maintenance agreement, like everything else, just never hits the problem spots. Oh, either we ran out. No, that doesn't affect it.
What was Lori doing? Are we waiting for her?
no,
Okay.
we can go ahead with it.
Oh, okay.
Because she didn't know how long, and I don't either.
I'm just gonna move on.
Yep.
Okay.
Yep.
We will move to our 10:15 item then. A general discussion with the Emergency Management Director and Julie Lyons, Public Health. COVID-19 updates. Take it away, Julie.
Well, good morning. I do have a couple of things I wanted to run past you. Yesterday, we put out a news release regarding further business closures based on Governor Reynolds' proclamation, and so we put that out for widespread distribution. I think the things that are of particular interest as we're coming upon some nice weather is that she closed all playgrounds, indoor and outdoor. It does not include private residence or childcare facilities. And then she also spoke to campgrounds, and she is asking that all public and private campgrounds be closed temporarily to recreational use. Okay, so people that are residing there long-term or permanently, that would not affect them. And then there are other businesses, but that's been published. Another document that has come out from the Iowa Department of Public Health is guidance on drive-in worship, which we're going to try to push this document out as we come up to this weekend and worship services. And there's really good guidance on drive-in worship and how to maintain social distancing and good infection control policies as they do that. So we'll push that document out. I did receive notice this morning that I had reached out to the Iowa West Foundation and asked for some emergency funding for COVID-19 response. This morning I got an email saying we did get awarded $10,000, and that is to help families who have been adversely affected by COVID-19. We're particularly targeting our most vulnerable populations, so that would be people who are over 60 who have underlying health conditions, and we want to make sure first of all that they have stable residence, that they have utilities if they're having problems paying bills, and then of course we want to ensure that there is no food insecurity related to all the restrictions that have come into place for COVID-19, and especially if we ask people to isolate at home, we want to make sure that we have food for them. So we just got that contract today, and Carol, I'll have to be getting some guidance from you on how we implement that. They are looking for us to use our Mills County Relief Fund to operate out of those guidelines, but to loosen all restrictions, to have very fast turnaround. We're hoping that we can give same-day service, or at latest next-day service. We're hoping to push a lot of those resources out rather rapidly, and then they have opened the door. If we use up those funds and we need more, we can approach them for additional funding. So we're pretty excited to have that resource. We do at Public Health deal with a lot of families who have come up against a lot of insecurities related to this disease outbreak, either because they're high risk or because they're employed in a field that their income has been temporarily altered, or any number of things. So we'll be working on that pretty quick.
Julie, did you say from Iowa West?
Iowa West Foundation, they have a COVID-19 response fund, and I think those funds will be immediately available.
Sounded like it. I was reading an article in World Herald last night, or this morning early, and they listed all the people, their organizations and things that got the money, so it shouldn't be long in coming.
Yeah, so once we get the notice, usually the check is in the mail, so
Good.
that will be very helpful. I just wanted to
Again, another disaster.
I'm just sitting there, yeah, okay, we can start spending it. You're not supposed to spend it until you amend your budget. So we got, yeah.
So you and I will
fun.
talk.
Yeah, we will. I mean,
You'll get me
obviously
straightened
more
out.
homework.
Right.
Yeah.
So you may have heard some talk regarding regional medical care coordination centers. So that is something that the Iowa Department of Public Health is doing under the
Pretty near
direction
you.
of Governor Reynolds, for the purpose of being prepared. And I just wanted to give you a couple of quick updates, because you will be hearing more about RMCC. The situation is related to the global pandemic of COVID-19 that has resulted in many ill persons and mortality across the world. Community spread of the disease is occurring in Iowa and poses a threat to overwhelm Iowa's healthcare infrastructure. And as a result of this, they are setting up regions where they will address those areas. I thought I had a map to show you. Show you the region. We are region 4, so we're in this neck of the woods. They're setting up these regional medical care coordination centers because we know that some counties, and I would include ours, Mills County, because we don't have a hospital, we don't really have the infrastructure to deal with a medical surge that they are thinking will happen as a result of COVID-19 in the next couple of weeks. So these regional areas are set up to address those. They are in daily contact with the hospitals. They're assessing information like how many beds, how many people are in intensive care, how many ventilators do you have, how many are in use, what is your bed capacity, what would be the protocol if your hospital can no longer accept, where would we go down the line to the next hospital. So they're doing a lot of work with hospitals.
That's a question I have. It's just a thought. If the hospitals are inundated, overwhelmed, if you will, do we have a YMCA or a school or any place with beds that we would move to, or has that been discussed, or is that?
You know, at this point, and I would invite you to read that document and see the details of it. Mills County, we really don't have the capacity or the equipment to provide the medical care that would be required if somebody had that level of respiratory distress related to COVID-19. So what we want to do is partner in the region We want to know where the hospitals are. The hospitals are setting up extra capacity. Tents are going up at both Mercy and Jenny, and we would want to get our people 20 minutes down to the road so they have the highest level of care and the best medical
We plan on
intervention.
busing them then, or busing them, or just hauling them, or
Yeah,
transporting them?
and they have all kinds of alternatives set up for that. So the hospital is one place where they're really setting up an emergency response that would include our county. The other thing that they're spending a lot of time and energy on is the long-term care facilities in Glenwood. We have 5 long-term care facilities. We also have 7 group homes that are considered long-term care facilities, and so we're working really daily with our partners in these facilities because the risk is so high there. I have Lori with me. I don't know, do you want to add any long-term care?
Well, the long-term care providers can test their own residents. The long-term care providers can test their own residents, and that has happened a little bit, and there has not been any positives that have come out of the long-term care yet. We have, one of our nurses is in almost daily contact with each of them, and she's also in contact with them for the PPE. We are trying to keep up with all of their needs, and Larry is pushing it out as they request it. So we have that going.
What's a PBE?
Personal protective equipment. So
Personal
gloves,
protective.
masks, gowns, face shields. We have an exact count of everything that we have available here in the county, and then as they request it, we try to get them to request it like about a week at a time. So how much do they need in a week? And it's amazing, you know, these long-term care facilities have high needs for gloves. They have high needs for masks. You know, right now every employee wears a mask the entire time they're there, and they're going through a lot of PPE. If they have procedure masks, they don't have to wear a face shield, but if they have the cloth masks, which some of them have gone to cloth masks, they have to wear the face shield too. So all of that is, we're keeping up with all of the different homes out there. So that is going on. What else?
So there's a personal protective equipment shortage nationwide, statewide, and locally. That's something that we're managing very closely. You might have noticed that we've done some press releases and we've invited the public to manufacture face masks per Iowa Department of Public Health guidance. We've had requests from some of our community partners to have access to those masks. We've gotten really good response from that. We've had kind of a bulk of them donated almost on a daily basis to public health, and then
Wow,
we are
fantastic.
sharing them with law enforcement, with our long-term care facilities and others. We also recently got guidance from the Iowa Department of Public Health regarding an ask for people to make gowns, and we'll be pushing that out on all of our sites today. I did have a person from the GRC contact me and say they're concerned about a gown shortage, and so they put out an ask for us to try to get our hands on more of those. And so
Does that
that's,
take a special material for that, Julie?
they have some guidance. So for like the face mask, they want it to be
100%
cotton.
cotton,
100% cotton.
And then
And then
for the gowns, I
gowns.
think it has to have a polyester.
polyester, or
And there's
polyester
very
cotton.
specific guidance, which I, off the top of my head, I can't give you exactly, so I would like to have that document and give really good guidance, but they do have some particular requirements for it, for
So
best practice.
Where could our people log on if they wanted to
So
sew?
we are putting all that information on Mills County Public Health's Facebook page.
Okay.
We're also putting it on the Mills County, Iowa Facebook page, and then we would also invite anyone, if they have any questions or concerns, to call our office directly,
Okay.
527-9699. We'd be happy to answer any questions that they might have. One other document that I was just going to run past you really quick because I thought it was really well done was done by our Congresswoman regarding COVID-19 information and resources. And she really delineates very simply public health information, resources for small businesses, for the public regarding the direct payments that are going to come to residents. worker resources, student resources, paid sick leave. It's just a very comprehensive document that we'll also be posting on our webpage because I think the general community would appreciate the information that she has shared there. And then we, as of yesterday, in the state of Iowa, had 946 positive cases. You also will, I'm sure you're very well aware, on Friday we put out an alert message that we did have our first confirmed case of COVID-19 in Mills County, and our nursing department is required to follow that very closely as far as surveillance, monitoring, tracking, and then entering all the data into the system at the Iowa Department of Public Health.
How many tests have we done so far? How many have we done and how many are we doing?
Well, that data is hard to track because some places it goes to the state hygienic lab and we get that tracked, and then some data goes to private labs and that's harder for us to track. And data is being compiled, but we don't have access. We can see what's happening in the entire state, but tracking exact number of cases in Iowa, we know all the positives for sure. We get those information, and then we have other people under surveillance. We don't necessarily get all the negative test results.
Oh, well,
And
then, go ahead.
They used to report how many negatives. Those were negatives that were coming out of the state hygienic lab and not all of the other areas, because I know of several tests that have been done that were negative that are not included in that data.
Yeah,
So
we personally
it's-
know of them and they don't
and
show up in the
they're
data
just
yet.
not
Well,
showing
then-
up.
I
It's
would.
kind of confusing to me. You're talking about how many different places are taking tests? How many different, I don't know whether you want to call them individuals, organizations, or it sounds confusing to me because you're telling me that these tests go here, these tests go here. Well,
Yeah, why wouldn't the right arm
Who's-
talk to the left arm?
who's taking them?
So we have different providers out there that will test, but they only test if people qualify for testing. If it's a healthcare provider, if it's a person who is hospitalized, if it's a person over 60 who has symptoms, if it's a person in a residential care facility, they only test those certain people.
And who's
And
they?
The
Provider.
state, the providers, the state hygienic
The
lab.
hygienic lab.
So, yes.
Okay.
So if you can
Right.
find a private lab that will test you, then you're lucky, because most of them are not testing. So when somebody says, I have symptoms and I can't find anybody to test me, that is true. You can't find people to test you. So unless you fit in one of those categories, most of the providers around here are following those guidelines and are only testing those people.
And we don't test anybody. Public health doesn't test people.
Public health does not test. We have a few contacts with a few different providers in the area that do. The ones that we're testing here in the county no longer are testing here in the county. It's just difficult right now to get tests.
I've heard that.
So we send them out. If we get calls, we have different people that we can refer them to for
We
testing.
do have really solid in-place protocol though, because not everybody does qualify for testing. So the protocol is very well established. If you are symptomatic, if you have a fever, if you have respiratory issues, we have a protocol in place for isolation that you have to, remove yourself.
If
You can
you,
go into-
if
So
you
got it and you're
are,
isolating.
yes, if you have the symptoms, you need to assume that you are positive and you need to isolate like you would be positive. So people who have COVID-19 need to isolate for the 7 days and 3 days fever-free and the symptoms getting better. So that's the qualification for if you have symptoms. Now, if you are exposed to a person who has symptoms, those people have to isolate for 14 days.
I was gonna say, what if I had it and showed all symptoms and was isolating myself, but obviously my wife would be there too. Automatically, she's 14 days.
She's the 14 days.
Okay.
Yes.
Okay.
So.
And you have to
Yeah,
think
can we
about
have
how
separate
that,
rooms?
you have to think about
you
how
do.
that comes into play even in a
Hope she's
business
not
setting.
listening.
So in this room, if somebody became symptomatic and and I meet all these benchmarks of I've had sustained close contact with you because of the nature of what we're doing or because in the healthcare we're required to be in close contact. If I came down with symptoms, I'm out for 7 days. You're out for 14. So you kind of want to set that up in your business practice. Maybe you want to set some contingencies in place so that you don't have to shut down an entire facility or an entire department. And we are working on those things daily with our partners in the community.
Yes, we are spending hours and hours and hours every day with just phone calls and questions and people from Mills County with questions.
Well, I know, yeah,
It's gonna get
as-
busier.
Yeah.
As one of the, I've seen on various different county, they all have, we have what we call base camp, and so then they'll throw things out there. Some of them are testing at the courthouses that are open but not open to the public. They're making all their employees do a temperature before they come in. I mean, access to thermometers, I know that's another tough.
There are no thermometers to be had right
That's
now.
what I thought.
We are, because we provide direct patient care, we do the temperatures at the start of every day for all of our employees. So we implemented that a couple weeks ago, and we're continuing to do that. And that is because we do patient care. So we want to protect them.
And the other thing that I've been asking, it's like, I don't know, don't ask me these questions. When you have a positive, of course, everyone freaks. And then I know in past, they had seen, okay, where has that person been? We don't have to do that now, right? Or we can't, or, I mean, so that,
Yeah, so what happens when we get a positive is that we do trace where that person has been, where that person works, everything there is to know about that person. And then we take that information and decide who is at risk. And then with that information, we would contact the people that we would consider at risk. So just consider yourself, if you haven't been contacted, we would not consider you to be at increased risk.
well, that's good for people to hear that,
So-
because I think they worry,
it's-
like, well, where at in Mills County? Where? But,
It's
I
it's
understand
that HIPAA thing that we cannot disclose. There's only certain things that we can disclose. And so that is how we do trace it. We do know, we do have those conversations. We just can't disclose that.
That's okay.
So if you haven't been contacted by us, then just consider yourself, you are at risk because it is everywhere in the community right now. But you're not at an increased risk because of this person's positive test. So,
Hopefully that'll relieve some concerns there.
Yeah, I
in
think that does
aspect.
help.
Yeah.
That's what I have, unless you have
Good.
questions.
Appreciate it very much.
We had a meeting yesterday with Middles. It was kind of like convenient meeting because there were some issues that Darren had, some inspections he had down Mills Landing, just some minor stuff with some people putting some decks up that weren't conforming with our building codes and floodway. So I got a meeting set together with Corey, him, and Rich. We sat down for about
Okay,
an
this
hour.
is about COVID, right?
This
Oh,
has to do indirectly.
Okay.
Because right during that time is when we got this declaration out, which affected campgrounds. It turned out that the declaration was detailed enough that since they're leased spots seasonally, that they are okay down there as long as they practice social distancing, which they had already said that they put out to their people, that they're gonna practice social distancing, they will not get in large groups around the campfire, and they're gonna monitor that and everything. So the other facility was Benton's, and I talked to Joe Benton yesterday. He does have people that are contractors, and which some of them are working on the levees, and they would fall into that category of a lease type, permanent, seasonal type thing. But he does have some mobile sites, and I did address that to him, that probably would be discouraged from renting those out for overnighters that are transitory still moving around the United States. So those two are taken care of. The other thing is the chamber is very aggressive in pursuing weekly conference calls. Every Wednesday, they have a conference call in the afternoon, a different topic. Last week, it was the Small Business Administration. They had Michael on there from the SBA talking about different grants that are out there for all the businesses and things of that nature. It is a very productive call, I think, that the chamber set up. And they're setting up 4 subcommittees. I think it's 4 committees they're looking for volunteers to move forward with some initiatives. within the chamber. So we definitely welcome and appreciate the business sector of the chamber with the lead stepping up for the community and the business sector in the county. So that's a good deal going forward. Hand sanitizer, it's tough to get. We have gotten some from the various places, these distilleries. We're having some donated from the Iowa Firefighter Association in Nebraska. We're picking up today. They're in gallon lots, and we are packaging those and we're labeling those. But it's 80% alcohol, so it'll dry your skin out. So you gotta use hand lotion every once in a while. And we did get some from a distillery over eastern Iowa that we've already packaged. And then the state of Iowa is going to send me some that they bought. So we're going to have quite a bunch of sanitizer, at least to get out to various agencies, entities, and some of these clinics and things like that as people request them. This RMCC thing, Julie talked about standing up, state of Iowa. The National Guard is playing heavily in this. In fact, that standard operating procedure that Julie has is really looks like a Guard document to me. And I think the Guard is going to be heavily involved in that operation and management of those 12-hour shifts that once they get fully up and going. And there'll be public health providers from IDPH and other stakeholders there helping to operate that facility up in Council Bluffs area where it's located at. Since we don't have hospitals, that information will be of info to us, bed counts, things like that. But the long-term facilities, they're going to want data from those daily, and it's a daily report. It has to be done in the morning. We can elect not to participate since we're a smaller operation here, but we'll still get the information. And that means they will reach out themselves to our long-term care and capture that data every morning for the state report, and then produce it back out to us. So that's a discussion I've got to have with Julie and Lori here and whether we're going to play or not, because it's a lot more effort on our part. And since we don't have a hospital, I'm just wondering whether we need to do that. The PPE right now, we have an electronic form that was set up that all our authorized people that tap us for personal protective equipment, the clinics and things like that, the long-term facilities, nonprofits, can fill that form out. It goes directly to myself and Nick, and then I fill it from there. And that allows me to track what is being requested and what's going out. So that's the process we're using right now in the county, and I think it's been working fairly well right now. And then I think I'm going to expand that a little bit, and we're going to track, instead of me having a stack of stuff, what's going out, I'm going to develop a spreadsheet that we can track each individual facility and the type PPE, so we can keep track of their quantities. So we can use those numbers as a data point also to manage from our usage. The state wants us to only ask for 7 days usage, and we're trying to get to what I think that 7 days is. But our demand is not as high as the metropolitan area, understandably. So the EMS services in the county, they have been asking for some PPE, but not a lot of face shields because of their closeness to a suspected patient or somebody that might be partially symptomatic or of suspect. I did talk to one of the fire chiefs and has an EMS service, and he requested that they do get face shields. So I'm looking to push out face shields to every EMS service in the county, and they're going to be a reusable type instead of a disposable type, probably those heavy duty ones. I think we're going to push out to them and to put in all their ambulances to use. And I think they're going to be needing to go to gowns eventually. So we'll work on trying to obtain additional ones of those and go from there.
Thank you, guys.
Hang in there.
See you next week or sooner.
Sure.
All right.
I talked to some ladies that are quarantined in the rest home of the resource center. She says, do you know how boring it is to sit here and look at the same walls every day for the past 2 weeks? I said,
Jill, did you have anything to add? Sorry. Did we get any questions answered, or do you want to?
Do you just want to talk about this? I have an employee who went to the doctor yesterday. She had not been feeling good. Last week, she called me on Sunday. She was headed to the doctor. She has the shortness of breath. She is not running a fever. They wouldn't do the COVID test on her because she's not in healthcare or being hospitalized. We are less than 6 feet from each other in my office. I'm trying to decide, or I would like some input on Do I close my office? Do I have these people quarantined for 14 days? They're calling it a flu, and they said, the note says, my employee is ill and will miss work. She will return once her symptoms have been gone for 3 days. Please excuse her. I just need some input on.
Public health protocol.
So, according to,
And you never heard back from the doctor?
No.
No.
according to what we are advising for everybody who has this situation, if you have symptoms of COVID-19, you need to just think that you have COVID-19. So the employee would need to stay home for the 7 days and fever-free for 3 days and symptoms improving. So that would be her. So we just assume she's positive, even though we don't know for sure. We have to assume she's positive. And then all of her contacts, her close contacts, would need to be isolated for 14 days. So if you feel like her close contacts here at work are closer than 6 feet, more than 10 minutes, then they would all need to be isolated for that 14 days.
What about the comment made about flu-like symptoms by the physician?
Flu-like symptoms, she had shortness of breath and chest discomfort.
Mm-hmm.
That would be a COVID symptom. So, and they did not check her for influenza A or B. I mean, so we don't have that ruled out. She didn't have a temperature. But it's the standard guidelines that if I had anybody call my office, which I have had,
It's like a concussion.
it's the same thing.
think you
You
have what
just
you do.
say you have to assume that it's positive. And this is how we're going to control the spread, is we can't just say, oh, we probably think that she doesn't have it. Everybody can stay at work. We have to assume that she has exposed all of those people. And so they need to stay home and away from people so that in case they get positive, then they're not exposing more. Does that make sense?
And we're not 6 feet apart in my office, and we are together more than 10 minutes at a time.
And so my advice for you would be that you all need to isolate for 14 days.
Except for the original person.
Except for
which is
the-
7 days.
Yes.
And day 1 starts with onset of symptoms.
So I would say day 1 would be Sunday, because that was her bad day.
Right, she didn't feel that well on Friday, but then she got progressively worse over the weekend.
So I would say her 7 days starts on Sunday.
So she would have to go a full 7 days
Full
and Sunday
7
to
days.
Sunday. And
Fever-free for 3 days and symptoms getting better.
then she could come back. She could come
So
back
she
sooner
could
than
come
the
back,
others.
she could come back next Monday, and you all would have to be off another week. So that
You
would
could
be my
possibly just
recommendation.
implement work from home wherever possible, I don't know.
Yeah, we're pretty much not a work from home office because we can't get ARCs on our home, which is a state run
The other
program.
thing is, as you look forward, I'm wondering if you maybe need to do something so that if one person has an exposure, not everybody has an exposure. And probably with all of the offices, that's something to look at. So,
Harrison County members have-
Okay. Thank you, guys.
They have somebody in their offices.
Carolyn, tell me about that, how we do the grant thing.
So I'm thinking about that.
thank you guys.
Thank you.
Thank you. Richard, what'd you find out on your
Okay,
generator? Who do you
this
want?
is great news, guys. Just want to tell you. Until we pay for it, they won't order it.
Whoa. That was not what they told me.
Well, that's what I'm waiting to talk to the lady.
We told them to put it on order.
Well,
Okay, so now I can't mess around then.
So if I get a hold of
Here,
her,
order.
find out, do I have the authority to go ahead and order it so that we can get it fixed? I
we'll have
mean,
to pay for it first.
I mean, we have to pay for it, I realize that, but,
Well,
We have to authorize that. we're-
authorize it.
exactly. Well,
And if we try to start looking for something else, it's gonna be
We could
another
be, we
couple
could be a
weeks.
month, 6 weeks to find
Exactly.
something
you're
to
not
come
gonna,
in.
and then you line up someone to hook it up, so.
Yeah.
Do we have a motion to approve the bid from Cummins Sales and
Huh?
Service on the courthouse generator?
I'll be in a little bit, make a phone call.
If not, we can let her sit.
I don't know whether we
I'm
just
sorry,
use
who made
our
the motion?
No
standby.
one has yet.
Oh, okay,
Yeah.
I thought it was
I'll,
something.
I'll make the motion to get her turning.
I'll second.
Got a motion and a second to approve the bid from Cummins Sales and Service. Is there any discussion now?
We better discuss all we can about it. I don't
Well,
know.
we can either wait. I mean, we can wait all day long. We can shop around, or the
Yeah,
as soon as we do that, we're gonna have a storm. Lightning's gonna shut the power off, and we're not gonna be able to answer 911.
Well, and I think the problem is, we could spend $2,000 to $5,000 just for a hookup.
Oh, at
Thought of
least.
that.
At
So
least.
even if we
At least.
used our standby,
Yeah.
it's not
Oh, yeah.
equipped.
You're
No.
a month away. By the time you it's not like electricians are sitting around waiting for us to call them to come fix this. It's gonna take you 2 weeks to a month to get someone here. You're a month out if we don't do this.
Yeah.
You
Not
just
knowing,
are.
not knowing
Yeah.
that they hadn't already ordered the
Yeah.
parts. Okay.
Any other discussion? Hearing none, all those in favor?
Aye.
Aye.
Okay, it's 14,000.
Motion
What was
carries
the total?
693.
It's 93.88.
Oh, no. How much? I'm sorry.
14. Go ahead.
14,693.88
Okay. Yippee. Just write the check.
Write a check.
Just write a check.
Just
Yeah,
write the check.
did it get fixed?
What's that?
The 15th, it should be
Was
fixed.
Lonnie
I didn't
supposed
look
to
at
sign this?
Lonnie's supposed to sign a lot of things. What is it?
I'll let you look at it.
Yeah.
I laid it there.
Is it right now?
Yeah.
Because I thought I fixed it. Okay, yes, he is signing here. He is Lonnie Mabry.
Okay.
Yes, his official signature. And then he has to sign, yeah, he has pages to sign. Yeah, he does.
Okay.
I think you got me a no on 14 though.
Are you kidding
You got me
me?
no on 15 now, but I don't think I voted no on
Definitely
14.
on 14. Crap.
Supervisors on a public
Well,
hearing.
what I
Okay,
had you
so I
voted
must
no
have
on
missed
was
a-
the $5,000 for
We'll
it,
fix it.
right?
Yeah, right. That's the only thing I voted no
I'll
on.
fix it.
After
We'll
the
get it fixed.
publication and review, supervisors terminated
I'm
proposed.
gonna go
Yeah,
make
I didn't
that
vote no
phone
against
call.
the budget.
No,
See
I
what
know
I
you
can find
didn't.
out.
It's, see, that's where I
Yeah.
went up one.
Yeah.
Don't do that, that's huge. I can't believe that. I can't believe that, Richard.
Somebody drew on your original.
Yeah.
You know what? I've
Go
seen
ahead
some.
and sign that.
I've
We'll
seen
just
some
fix it.
originals they were drawn on anyway.
Yeah, we'll get it fixed. Sorry.
What can't you
I
believe?
knew I had typed it as that.
14,000.
Oh,
Wow. So maybe we should have a hookup if we need to bring in our lease generator.
Well,
what kind of
we are-
hookup you gonna put on it?
There, well, I think,
I don't know. What does it
Patrick
take?
said-
Nor do we, because every different generator's got a different hookup.
So
So
why do we even have this one down here if we can't use it?
well, we're looking, it's a,
you can if it happens to hook up if you have an existing adapter for it now. But if you don't, you need an electrician to hook it up. Otherwise, it's just a generator sitting there.
and that's why they had Ben look at it. But like
Right.
Patrick said, the battery backups will handle it for a while, but not for days.
Yeah.
If we're-
I can just initial that.
Well, we want to fix it because that's okay, we can.
When I just write A and then I'll initial it, and then it's good.
Yeah, but we just have to regroup it to the papers. See, I knew I had put an A in there somewhere. It's just not in the right place. I was like, no, I know I did that.
Yeah.
But, you know, hey, when you type in this at 7:00 at night on Friday, you know,
Exactly.
anything can happen.
It happens.
Okay.
All right.
You want to make a call? Do you need to bring up about the?
General discussion. We did have the Judge Larson from District Court, Fourth Judicial, sent us all a letter about his concerns with closing the courthouses. The judicial branch still needs to keep running, whether we close the courthouse or not. So, we're gonna keep it open for the courts. If they, set an appointment up to, bring someone in and out, we'd be more than willing to let them in.
I wonder if we need to do like a letter or have you sign off
Probably
on
wouldn't
it
hurt.
that
Probably wouldn't
what
hurt.
our criteria is.
What our
because-
policy is, and
yeah.
if the judges need to let them in, they can let them in, or if a officer or county attorney's office or anyone else, I mean, we'll work with them. They have to keep moving. I mean,
Right.
unfortunately, domestic abuses and robberies and things like that happen, so they need
Well,
to
and
get
then,
in.
they would be, I'm assuming whoever they would have, the bailiff or whoever, asking the questions of
Right.
people when they're coming in. They'll fall under the social distancing while they're there.
Sure.
They'll have to make sure that, and then we'll make sure that the janitors have, made sure that they clean everything up right afterwards, but, they would have access through the clerk to get to that area without coming through the rest of the
Right.
court, or the courthouse.
I mean, how we are designed, it would work. I mean, just come through there and,
Yeah, they get in and out.
right, so it would work. Yeah.
Sure.
Sure. And-
I would consider that essential along with
Okay.
everyone else, so
Okay, I'll work on the.
Yeah, we'll
letter
see if we can
and
get a
send it
letter.
out to you and we'll see what
Yep.
you- yeah.
make Tyler write it up. He's not doing anything.
Yeah, that's what I was thinking.
Hopefully he's listening.
I'm sure he is. One other thing, I'm still struggling with trying to figure out how to do it, and it doesn't happen until May 4th, where we're required to have in-person voting, okay, absentee. I'm still trying to figure out the logistics of how to do that. Lori and I bounced several things off. We don't know. I mean, we've talked about the backside with having someone sitting down there for anyone that comes in, having the forms there, what have you. We've talked about several different things. A suggestion was brought to me yesterday of having someone sit down at the bottom of the steps and have them come through this door, and then that person would let them in, that they're close to our office. And it's like, well, which one of my employees do you want me to have sit down there all day? And they said, well,
Right.
we could get you a volunteer. Plus they said, well, the governor got extra money for this, so that she could pay for your person or whatever. And I was like, okay, so I'm open for discussion from any of you. If you have any suggestions, I've been racking my brain trying to figure out how we're gonna do it. Curbside voting doesn't really sound like, and, we were gonna have to, not let them in more than, and it's, yeah. So,
They need access to a computer when they check in though, correct? So we have to have a
we
computer.
would need access.
Right, right,
So,
right.
Patrick has optioned, if we went out in that, he has that little computer room and, where he keeps stuff. We could actually have a laptop and a label there, but we don't feel comfortable taking our ballots there. So then we're gonna have to have a second person, bring us the ballot. So we'll have to have a communication, say, hey, I need a ballot for blah, blah, bring that out here, and then have the voting booth set up out there. Logistics is probably, and maybe after April 30th, this won't be an issue, but I really,
You only
really,
got 4 days to figure out what you're gonna do, so.
I know. So I'm really, and that's why we're trying to be it, and I'm trying to get it out there to the public as we're really
We have to have
in
open,
person. Yeah.
in-person voting.
Yeah,
Okay.
that's why we're really,
Right.
the Secretary of State is sending out absentee request forms with an envelope for them to return to us, encouraging people
Sure,
to mail them in.
sure.
So, but some people still want to
Some people
come
just wanna
in.
and vote.
We're still gonna have the polls open, and we're making allowances to do all of that. We've combined them. So still lots to be figured out with that whole issue, but I'm open for any suggestions any of you may have, as well.
You've done this much more than I have, so I'll follow your lead on it, support you, whatever it is.
And hopefully, since they've been homebound, they understand that a lot of them will just vote by,
Well, I
The mail?
hope so.
Most will,
But
but
you're
you're still
gonna
gonna have
still
people
have-
coming in.
Yeah, it isn't a
Absolutely.
huge turnout election anyway,
I get it.
because people don't want to change parties, or, they don't want to have to declare a party, especially if you're a no party, or, and some people don't want to cross lines. Locally, we have no one running on the Democrat ticket. But on the state and federal level, we do. So,
That's-
and then, so we have a lot of
Yeah, well,
races
it's-
that are,
yeah.
yeah. So, I don't know. I think a lot of people, and I've tried to urge them to understand that the presidential is not on the primary. That doesn't happen until the general. So, that is another educational thing we have to do with the people. But I do feel bad for everyone running, especially with the competition, because this is a tough year to do it.
Oh, yes.
Because you don't have an
Hard to
opportunity
go
to have,
campaign and rally when
Yeah,
when you don't,
yeah.
when you can't have a group.
can't do door to door, can't,
No.
Do a forum,
No
can't do
forums.
any of that.
so. Tough times, guys.
I'm not so sure you can even do Facebook.
Well,
Facebook
Thanks,
Live.
yes, yeah.
The fact that you
You're
could
hearing
do
what the public health said. I would like your blessing in closing my office for 2 weeks.
I don't know, can the county
So
do that?
yours, I mean,
How long did Harrison County close? How long did Harrison County shut theirs down?
and the only other concern on that is we all use the same restroom. How many other people are affected?
You guys are all exposed.
Well, I mean, if you happen to be, I mean, that's one area where everybody, well, except you guys, you're out there. So which one of you wants to be treasurer and
I
which
was gonna
one
say, well, I
wants to
guess
be
we just fill
auditor?
in then, don't
No.
we?
I don't know. I mean, I don't know if I know maybe there's probably a way that you can have your calls forwarded to one of you, but, I don't know. How did Harrison County do it? Do you know?
I mean, you can't shut down the taxes, you can't shut
Well,
down
taxes should be, well, I mean, there's still,
drivers.
I
They've been
mean,
extended, so they're still coming in. Extended as second.
It doesn't have a whole lot to do with real estate or anything.
so
Other
could
than taxes, right?
someone come in, well, it doesn't really matter after hours. I mean, if
I-
one person.
I asked this public health if that was a possibility, if after the office closed, if I could come in and like from 5:30 to 7:30, as long as I stay just in my office, disinfect everything when I come in and disinfect everything when I leave. Possibly another person, but not at the same time, but once the office is closed. So we can continue to try to get registrations out. We won't be meeting people face to face to pick up titles and those kind of things, but
And did
Or
they
we
say
could-
that's doable? I mean, did public
Yes,
health say
yes,
that's
she
a
said-
doable thing?
Yes, she told me that in the hall, that was
I'm fine with that.
an option. Or I could try to run the split shift that I had asked for earlier, maybe 2 of us,
That's
Three.
an option too, Jill, so.
3 of them off, and hopefully nobody will get it, and
It's
So
your
we
office and I would say try to keep some kind of flow, even if it's a minimal flow. You're not gonna get everything done every day, you're not gonna get all your day-to-day business
Exactly.
done, but at least you can keep something coming in and out.
Okay.
But policy's policy.
And I know Michael takes care of your deposits, so at night you could set that someplace or something, or someplace where he could get, because you can't get here banking. I don't know, how long are they open, or I don't know.
Well, do you usually do yours in the morning or do you do it in the afternoon?
Morning. first
Just
thing
in the morning,
first thing in
so,
the morning, we go
yeah.
and sit down.
Okay.
Yeah, so if it's available, then that would be easier to do.
Well, I think, don't get me wrong, I'm not against it, it's just that some of the guidelines they've set up are a little bit misleading, cross-reference, well, but I can see where you're coming from.
Well, and I was not aware that you and I could not go in and if we were having these symptoms and get a COVID-19 test. I didn't know it was safe for just hospital workers or essential workers and
Well,
And
what makes
somebody
it
on
bad
being
is you
hospitalized.
don't know whether you've been legally exposed or not. I mean, she can come back and, I'm not running her down or anything, but I mean, the person comes back, in 7 days, she could break down with it then. I mean,
7 days she can be back. 7 days from Sunday, so she's not gonna be closed for a couple days.
but like the doctor also says she has to be symptom free for 3 days after after
No
she's.
fever.
No
Yeah.
fever, 7
And
days.
she doesn't have a
she
fever.
never
Fever
did have
free
it.
for 3 days, yeah.
Yeah, and he didn't,
So
he just
7
says
days.
symptoms.
Yeah,
For
7.
3 days after her breathing problems go away, she has to be symptom free for 3 days after that. That's how he wrote the note.
Okay.
That's
My,
how he wrote the
yeah,
note.
and my
Okay.
advice would be visit with Jolene, with regards to how logistically we have to do this with the, the federal guidelines on the.
Yeah, I already talked to Larry and the public health, and they said that falls within the guidelines of
Right,
what
right, but I
Jolene-
mean,
yeah.
Jolene can tell you what's there, I mean, what's expected and isn't, I mean, where
Okay.
they're at and how it works.
Yeah, she sent me all that stuff.
Okay.
Okay. All right, thank you.
Thank you.
Can we create any more fun today? I don't think we have anything else on the
Anything else
agenda.
going on?
I think that's it, or, that's pretty much all we can come up with for now.
Okay,
All right, is that it, guys?
that's it.
All right, do we have a motion to adjourn?
So move.
I second.
Motion and second to adjourn. Any other discussion? All those in favor?
Aye.
All right. Thank you, everybody, for listening.
See you next week.
We'll see you next week.